happy to be together this evening to talk about something that really affects each and every one of us because it's a tiny little molecule that's created in each of our cells. We want you to remember that this is an educational series and that the statements that are made have not been evaluated by the FDA, and the products that we talk about are not designed to treat, cure, prevent any disease. All right? And so that tiny little molecule, it goes by the name of glutathione. And what glutathione does, well, let me just show you a little research that I was able to put together here that gives you the basics of what glutathione does for you and for me. Okay, I'm going to go ahead and share my little chart here. And it's a little different this evening because we're going to still use that memory aid, an idea. Glutathione is an idea whose time has come. Now, I researched it over Google, which is just a search engine, as well as in the National Library of Medicine, and you can see the results. Now, to just go along with the memory aid, the AN is for antioxidants. And Google has over just almost 1.5 million references to glutathione as an antioxidant. But the peer reviews show there in PubMed 69,700 results to show how glutathione is the master antioxidant. Other antioxidants that you take orally, they don't work if you do not have glutathione. For the immune system, 27,500,000 articles to show how important it is. In fact, it's the food for the immune system. And the peer-reviewed studies and published papers there in PubMed give us 8,206 results of how when you optimize glutathione, you are feeding your immune system. So we want to make sure that we always have our glutathione levels at optimum levels because it is the food that keeps our immune system strong. And then we went to detoxifying. It's the most important detoxifier Google. When we look at glutathione as a detoxifier, almost 2 million references there, but it's been peer-reviewed at least 4,371 times as the most important detoxifying enzyme that you can possibly have because it detoxifies down into the cells. It's not just a serum cleanse, but it can detoxify heavy metals and toxins that are in the cells that are creating damage in the cells. And then we go to E for energy. And as we see here, we have 24,600,000 references there in Google, glutathione and energy. Well, it's been peer-reviewed and published there 5,191 times because it tunes up those energy producers that we have in the cells. And just imagine the trillions of cells that we have, the energy producers within those cells, within those trillions of cells, receiving a tune-up. That's what allows us to benefit as a result, gaining energy, feeling that energy as a result of optimizing glutathione. And people notice it. They start asking us, what in the world are you doing? You're acting like you have so much energy. And it's so subtle and effective that we might not even feel it ourselves until someone brings it to our attention. And then finally, we have the A, and that puts them all together. 12,000 references there in glutathione and anti-aging. And when you optimize glutathione, it benefits the cell, it optimizes the cell, and it's been peer-reviewed over 500 times to show that it can surpass all the average limits placed on the cell so that you and I receive the anti-aging benefit of optimizing glutathione. And so that's just a little research I put together there that helps us to appreciate the basics of glutathione. Now let's go into our main topic, which is our main event for the evening. And Jim Spencer is going to share with us Jim has been training people for decades now. And so many people around the world appreciate Jim. And we're glad that Jim takes time out each Sunday to help us understand the importance of optimizing glutathione and how we can actually do it. And he's going to talk with us the benefits of glutathione in Parkinson's disease this evening. So, Jim, we'd like to turn it over to you.
Thank you, Bruce. Can you hear me all right? All right, good. Well, nice to have so many of you with us today. We have around 130 people and climbing. And looks like you're from all over the country and even from some other countries. So nice to have you. As Bruce said, the research on glutathione has grown prodigiously in the last several years. And it's upwards of 500 to 1,000 studies per month that are being published. And so tonight we're going to take a look at some of the very specific information, some of which has been available for a couple of decades, but sometimes it's hidden. And there's not a lot of doctors that have started to use glutathione therapy just yet, but it is growing. So let's take a look at the information that we're going to share today. Benefits of glutathione therapy for Parkinson's disease. Now, Parkinson's, also known as PD, it's a long-term degenerative disorder of the central nervous system, and it primarily affects the motor mechanism, and it works at this part of the brain. It starts in some cases very slowly, but as the disease worsens, the tremors get worse, rigidity, slowness of movement, difficulty walking, cognitive and behavioral problems also occur. Now, there's actual historical records of this that go back several thousand years, but in modern times, it was 1817, a British doctor named James Parkinson. He did so much work with this illness and identified so many of the symptoms that's how the disease got to bear his name. And today, there's quite a few people impacted, about 145,000 in the United Kingdom. And in the United States, about 1 million people. So there's currently no known cure for the disease, but existing treatments are geared toward basically making it easier to live with, reducing symptoms. But imagine 1 out of 100 people will develop Parkinson's, and half of them do so by the age of 40. Now, the symptoms include, to begin with, a tremor in just one hand. And slow movement, stiffness. Eventually, the tremors go over to another hand, and the body begins to have difficulty standing. There's involuntary movements, muscle contractions. Sometimes the sleep is messed up. You can have nightmares, sleep disturbances. There's fatigue, dizziness, and it gets worse. Cognitive abilities begin to wane, amnesia sometimes, dementia. Speech sometimes begins to slur. You lose the sense of smell, and urination becomes a problem. You can have a lot of anxiety or apathy, quite a distance apart. Jaw stiffness, and then there's the facial expressions. You might just stare. There could be depression. You know, it's a very, very difficult disease to deal with, particularly with people that have been very active in life, and then when these type of symptoms kick in, it's really tough. There's 5 stages of progression that have been identified. The first stage is the involuntary tremors just in one hand or on one side of the body. Stage 2 would be when it moves over to the other side. Walking may get a little bit difficult at this point. But stage 3, which is considered the halfway point, that's when loss of balance, slowing down dramatically, and falling. And that can be really something that requires assistance just to get around. But stage 4, the symptoms are more severe. You might be able to get standing, but you need a walker to move, and you'd probably not be able to live alone. And of course, stage 5 is the most advanced. It gets almost impossible to stand or to walk. The person requires a wheelchair or is totally bedridden. And at this point, you have to have assistance, sometimes round-the-clock nursing, and there might even be hallucinations and delusions at this point. Well, the way they describe it in the literature and the way individuals are affected is that the chemical dopamine is not able to be produced significantly in the brain. And this is what involves movement. And so it is that in this central part of the brain, beginning with the basal ganglia, this chemical begins to go down. And as it does, increasingly, you're going to feel the effects of this disease. Now, it's interesting that if you put the Parkinson's disease alongside multiple sclerosis, muscular dystrophy, Lou Gehrig's disease, there's more of it than all of these combined. And another 60,000 cases are diagnosed each year, and worldwide about 10 million people. Now, the incidence of Parkinson's does go up with age, but there's even juvenile Parkinson's, which is a surprise to me. It's rare, but it could happen even with a young child. Men are more likely to get it than women, and I'll explain why in just a moment. It's due to this bad news. The disease is linked more and more to toxicity from an ever-increasing array of chemicals that are produced in modern society. So if you go back 100 years ago, there was far, far less of it than there is today. In fact, there's a new book out. It's entitled Ending Parkinson's Disease. There was a write-up about it in the New York Times. And the book calls Parkinson's a man-made pandemic. And its prevalence is closely tied to the growth of industrialization. Parkinson's disease has increased dramatically with the use of pesticides, solvents, degreasing agents in the countries around the world that begin to use them. And over the last 25 years, the prevalence, adjusted for age, increased 22% throughout the world, 30% in India, and 116% in China, which is starting to really industrialize in this past 25 years. And of course, men, generally speaking, wind up doing occupations where they're exposed to more of these industrial products, so they have this greater increased risk than women for developing it. It was noted that many of the Vietnam War veterans have started developing Parkinson's, and now they've traced it back to their exposure to Agent Orange. So there's a dramatic increase in the possibility of you getting Parkinson's if you were ever exposed to that type of toxic substance. Now, conventional medicines, for the most part, try to get the dopamine replaced. So as you look at some of these different things, it's begun to be used in recent years, such as deep brain stimulation, or DBS, they actually have electrodes inserted into a specific area of the brain, and they use an MRI to direct their positioning of this. And then they put an implant in called an IPG. It's able to, it's like a little battery, and the individual that goes through the surgery gets a controller that can turn the device on and off, and it is able to release that electrical impulse, and it's had a lot of benefits. Again, not a cure. It doesn't slow the progression, but it can help control symptoms. And then there's another type of surgical procedure that's used to get more dopamine into the body. It's called duopa, and they have to actually surgically put a small hole called a stoma in the stomach wall, and then there's a tube placed in the intestines, and then a pump delivers the drug directly to the intestine. And there's also some prospects with stem cell replacement that have been observed. And there's all kinds of complementary treatments like yoga, massage, and acupuncture, music therapy, art therapy. It's in many cases helping the person to get exercise, which is really fundamentally a very good complementary treatment. Some of the alternative therapies include an herbal supplement called Mucuna pruriens, and it can help replace the lost dopamine. Acupuncture helps some of the symptoms. And then there's glutathione enhancement therapy, and we'll spend the rest of our time on that. Now, why is it that glutathione will be so important for a Parkinson's patient? Well, first of all, because of the toxicity that seems to be at the root element, a root element of what's causing it in the first place, glutathione is the most potent way to detoxify and get some of these things out of the body. And it can safely neutralize free radicals, which now they're finding in more and more clinical research that there's a tremendous amount of free radicals common in Parkinson's disease. Also, oxidative stress, very high. So glutathione lowers oxidative stress systemically. Glutathione dramatically improves the immune system, and this would help the person that is already having a difficult time to be able to have a better way of fighting bacterial and viral infections. Now, here's the bottom line. In all of the research, it seems to point to the fact that glutathione is very low in Parkinson's patients. And we're going to spend a little time showing you some of the research that's come out about this. This one goes back close to 30 years ago. And they were doing research with Alzheimer's and Parkinson's disease and measuring the brain levels of glutathione and glutathione disulfide and vitamin E. Now, they had two groups, a control group and then a group of patients with Alzheimer's and also Parkinson's. Notice this, the control brain samples contained glutathione levels more than 50 times higher than the reduced glutathione, the exhausted glutathione. So that's an incredibly important point that no one put two and two together, but the normal brain, 50 times more glutathione than someone that has Parkinson's. And at the bottom, the results may indicate that compensatory increases in glutathione and vitamin E levels occur following damage to specific brain regions in patients with Alzheimer's disease or Alzheimer's and Parkinson's. Now, here's an oxymoron. The most common medical treatment that is used is the one that's designed to raise dopamine. Well, eventually, the dopamine becomes toxic to the individual. And that results in the drugs becoming ineffective. After a few years, they don't work anymore. And then the patients begin to deteriorate, and sometimes very rapidly. So, let's take a look at the studies that indicate a surprising benefit of glutathione. Now, here's one, again, 25 years old, selective role of glutathione in protecting human neuronal cells from dopamine-induced apoptosis. So they found in this study that they could help protect someone from the toxicity of the dopamine drug. Notice here it says the results indicate that glutathione has a selective role in protecting human neural cells from the toxic effect of dopamine. Interesting. Now here's another one published around the same time, oxidative stress and the pathogenesis of Parkinson's disease. Now notice the highlighted points. A loss of glutathione is associated with incidental Lewy body disease. This is another form of very similar to Parkinson's. And it may represent, notice this, the earliest biochemical marker of nigral cell loss. So they're suggesting that you could actually find out or diagnose a patient that's developing Parkinson's by simply seeing this loss of glutathione. And glutathione depletion alone may not result in damage to nigral neurons, but may increase the susceptibility to subsequent toxic or free radical exposure. So they were a little bit unclear, but you notice as we go along, it gets clearer to the researchers as they find out more and more. There was one, prevention of dopamine-induced cell death by thiol antioxidants, possible implications for treatment of Parkinson's disease. Now here is where they finally say, well, wait a minute, if it does all of this, maybe it should be a treatment for Parkinson's. Well, they start out by saying, we've recently shown that dopamine can trigger apoptosis. All right, so that was understood. And now further in the abstract, it says, we have found that depletion of cellular glutathione by the addition of furon, a substrate of glutathione transferase, and buthionine sulfoxamine, an inhibitor of gamma-glutamyl transpeptidase, significantly enhanced dopamine toxicity. So they found that simply not having enough glutathione, the toxicity is just going to continue to go up and up and up. Here's one, reduced intravenous glutathione in the treatment of early Parkinson's disease. Now, 25 years ago, they weren't really clear on how you were going to raise glutathione. So in some cases, they were using some drugs to do it. They used oral glutathione, but they found that the intravenous glutathione had a fairly rapid result, but it wasn't sustained. So here in the abstract, it says several studies have demonstrated a deficiency in reduced glutathione in the nigra of patients with Parkinson's disease. In particular, the magnitude of reduction of glutathione seems to be parallel to the severity of the disease. So the lower the level of glutathione, the worse the disease. Our data indicates that in untreated Parkinson's disease patients, glutathione has symptomatic efficacy and possibly retards the progression of the disease. So it's interesting that a couple of decades ago, these studies were showing these kind of results. Well, let's flash forward a dozen years, 15 years. They got a little bit more dramatic in their comments. N-acetylcysteine, what is that? Well, that's a precursor for glutathione. N-acetylcysteine in the treatment of Parkinson's disease. What are we waiting for? You didn't believe it. That's the actual name of the study. And they comment here, recent publications have confirmed previous results and hypotheses about the probable role of thiolic antioxidants in Parkinson's disease. This thiolic antioxidant is a modified form of the natural amino acid cysteine, which is the precursor of the most potent intracellular antioxidant, glutathione. Finally, it says the present paper put forward the existing rationale evidence for the use of N-acetylcysteine alone or in combination. Well, here's one of the most recent ones. And what did they use? They used a whey protein concentrate as a supplement to raise glutathione. And the study also showed that it was able to lower homocysteine in addition to its benefits. So the results, significant increases in plasma concentration of reduced glutathione, and the ratio of reduced to oxidized glutathione were found in the whey supplemented patients, but not in the control group. This was associated with a significant decrease of plasma levels of homocysteine. Well, why isn't this being jumped on by doctors? Why is it that there's a million people in the United States with Parkinson's, and if you go and knock on their door and ask them if they've ever heard of glutathione, they're going to look at you and say, "Gluta what?" Good question. Well, it's an ongoing work in progress, isn't it? As they find out these different things. So our point tonight is to teach you how to increase glutathione safely and effectively. Can you eat it? Yes, you can, but we definitely don't recommend that because oral glutathione is broken down in the stomach and passed as waste. Can you inject it? Yes, and you could see from some of the studies that is being done. But injectable glutathione is invasive. You need a doctor. It's not that cheap. But here's the real problem. It has a short half-life. And there are videos that show Parkinson's patients being injected with glutathione. Now, they were walking very slow. I mean, it might have taken them 15 minutes to cross the room. An hour later, after the injection, they could walk across the room pretty quick. But a few hours later, they're back to walking slow again. So it was the short half-life that was the complication. Also, the injectable glutathione is too large to get into the cells, so it raises extracellular glutathione, not intracellular glutathione. And that's the most important one when it comes to raising glutathione, because you also want to raise it in the brain. But injectable glutathione has a little bit of difficulty getting past the blood-brain barrier as well. So again, it can do the job, but not that well. What's the best way to make your body increase glutathione? It's give your body the ability to make it. Use precursors, glutathione precursors. And that helps the cells throughout your body. Not all precursors are equal. The drugs are all with limitation. N-acetylcysteine also has a short half-life, and it breaks down into harmful components. The other ones like SAMe, OTC, OTZ, GSH, monoesters, they all have some kind of a complication. Out of the whole entire group, probably NAC and SAMe would be very good under some emergency conditions, but not necessarily something you want to do every day of your life. The natural products are the route to go, and let's spend a little time on them. As I mentioned, oral glutathione is practically worthless, so don't waste your time with that one. L-cysteine is a synthesized form of cysteine. Doesn't have much protection, so it also is broken down in the digestive system. And if you take too much of it, you could experience some toxicity also, like hypercystinemia. Methionine is viable, but you have to be careful with the doses. Certain doses can be toxic, and unfortunately, this can elevate homocysteine, which is a risk factor for atherosclerosis. So it's not on my real recommendation list. Melatonin is a natural hormone and an antioxidant. I recommend the tart Montmorency cherry concentrate because it actually can help your body make glutathione. And this is particularly good with anything that affects the brain, because it'll help you get more glutathione into the brain. The glutamine, it's oftentimes used for bodybuilders. They don't necessarily recommend it for the average person. You have enough glutamine in your diet, but it is a constituent needed for glutathione. It's just that you probably don't need it, and it can also give you some gastrointestinal upset. But of particular note is older people who have kidney or liver problems. They should be careful with glutamine. Now, lipoic acid, you can take up to 500 or 600 milligrams at a time. It's a helpful antioxidant because it helps to convert oxidized glutathione back to reduced glutathione. So it kind of helps recycle it. And it protects against lipid peroxidation. So this is a good nutrient for you to have. And silymarin has been used for a long time. It's milk thistle. It's an herbal extract that's beneficial for the liver. However, it's not a regulated product, and it might be a stretch to say that you're actually going to get silymarin. In many cases, you're not. The whey proteins are really the ones to look at the most closely, but it's got to be a whey protein that's actually specifically designed for elevating glutathione. Most whey proteins are not. So it brings us to really the top one on the list, bioactive whey proteins. These ones are specifically designed to promote glutathione activity. And they preserve the undenatured proteins. You've got a very special form of cystine that goes through the stomach and into the bloodstream. There's no side effects, no contraindications, and this is the one that we recommend the most. Now, the proof is in the pudding, so to speak. So we have some examples of how this type of precursor has worked in real life. So let's call on Rebecca Conti. Rebecca, are you with us tonight?
Sorry about that. Yes, I'm here, Jim. Hi.
All right. Thank you so much, Rebecca. Rebecca is out in the Chicago area, and I've known their family for many years. Rebecca, tell us the story about your grandmother, who really began to have some complications with Parkinson's.
Okay. So my grandmother was born and raised in Japan, and she was a very active lady even up into her older years. She lived with her grown children, doing cooking, cleaning, and just doing all kinds of things for them. She was used to being very active. Anyway, later on in her life, about around her early 80s, she developed Parkinson's, and that limited her activity considerably. Eventually, it progressed to tremors, and her doctor prescribed some medication for her. So my mother, who lived here in the States, decided to go to Japan for a few months to help take care of her. She also wanted to try glutathione enhancement therapy. So my mother took with her a bioactive whey protein that wasn't available in Japan, and began giving it to my grandmother while she was there. Over the course of a couple months, the symptoms began to subside, and after 3 months, her shaking and tremors stopped, and gradually the other symptoms went away. And on one of her visits back to her doctor, he was so impressed with the improvement she had made, and of course he attributed it to the medication he had prescribed for her.
Naturally.
But truly, my mother could attest to this, that my grandmother only really began to show significant improvement after she began taking this bioactive whey protein. And just a little side point, my mom ended up staying in Japan longer than she had planned, and she did not bring enough of the bioactive whey protein with her for herself and her mother. So she began using her own portion and giving it to my grandmother so that she could continue on it. After several weeks of not taking it herself, my mother noticed a huge difference in her own health and well-being. She noticed she tired much more easily. She just had less energy and stamina. So when she got back to the States, she was so happy to resume taking this bioactive whey protein again.
Excellent, excellent. I understand from your mother that your grandmother lived another 10 years in relatively good health.
Yep, she lived into her mid-90s. I think she was 94 or 95.
Wow, great story. Thank you so much for sharing that with us.
You're welcome.
All right, so now let's talk to Jeanette Martinez. Now, Jeanette Martinez is going to give us the case account of her own husband. So are you available, Jeanette? Okay. Okay, Jeanette. So I understand that you've had some firsthand experience with Parkinson's right in your family. You want to tell us about it?
Yeah, in my case, it's my husband. He developed Parkinson's around his 40s. He was very young. And when it was something really devastating because the doctor said that he really had a very bad Parkinson, that it was going to develop rapidly. And, you know, he was still so young and he had to work. So we didn't know what to do. So I looked for many, many alternatives. At that time, I didn't know what to give him. So I tried everything I heard about it. So 4 years ago, I heard about this bioactive whey protein, and my son told me, Mom, you have to try it because I've seen how good this is for many people, especially for his father-in-law. So I said, let me try one more thing. Why not? So at that point, he couldn't, he didn't have energy. He used to fall constantly, and that was worrying me because those fallings constantly could cause him more harm. So when he started using it, we gave him 60 grams a day. And he was, after a month, I saw more energy. After a couple of months, one day I came from work and he vacuumed the house and I was, I love this. I'm going to continue giving this forever because he helped me at home. So we have seen a lot of improvement. He can now eat by himself. We used to feed him. He can dress by himself. He can take a shower by himself. So we have seen so much improvement. It's amazing. It's something that we're so happy about it. And he feels happy. He feels happier because he was so sad. You know, when you're young and you cannot work, you cannot do things that you used to do. It affects his nerve system, so it's helping him. Last time we went, we had a conference with a neurologist. He told me, I have seen this. This is not affecting him anymore. This illness is not progressing, even though he had an aggressive Parkinson's. And it's true, it's not progressing. We have seen that he has been getting better. I mean, he's not cured totally, but at least he has quality of life. That's why we wanted to see him, happy. And it's wonderful, all those changes that we see. We give him now 40 grams a day, and I'll be continuing doing this. This is the best thing we have done for him.
Wow, that's a great story, Jeanette. And thank you so much for being with us tonight. Well, let's go back to and finish our program. I think you'll agree that basically glutathione is very good news for Parkinson's patients. Now, there's literally 150 to 200 of you folks listening to this tonight. Imagine if you each told 5 or 10 people that had Parkinson's about this. That'd be several thousand people that would hear. And just think of the impact that you would have on those folks. So continue to spread the word. Our discussion next week is going to be on glutathione and multiple sclerosis. So again, something that is a devastating illness. We're going to see how glutathione can impact multiple sclerosis. Now, if you had questions tonight, the person that invited you on the call can arrange to have your questions answered. If not, they can track me down, and I'll answer the questions personally. But for the sake of time, we'll let those individually do that for tonight. So I want to thank all of you for being with us tonight, and we also appreciate Bruce being our moderator tonight. And so Bruce can release the lines, and we'll say goodbye to everybody as we sign off tonight. And again, thank you both of our guests tonight, Rebecca Conti and Jeanette Martinez, for sharing those very, very important